Have you ever brushed off a sudden wave of dizziness, blamed a numb hand on sleeping the wrong way, or laughed off a moment when you couldn't find the right words? Most of us have. After all, getting older comes with aches, pains, and the occasional off day. But what if one of those small moments wasn't as harmless as it seemed? Here's something many people don't realize. A stroke doesn't always arrive with dramatic warning signs like the ones we often see in movies. In many cases, the body sends quiet signals hours, days, or even weeks beforehand. These early clues can be so subtle that they're mistaken for stress, fatigue, dehydration, or simply getting older. The good news is that recognizing these warning signs early can make a real difference. While not every unusual symptom means a stroke is coming, knowing what to look for can help you act quickly if something serious is happening. And when it comes to stroke, every minute matters. Today, we're going to explore 7 silent stroke warning signs that adults over 60 should never ignore. We'll explain why they happen, what they may feel like, and when it's important to seek immediate medical care. Be sure to stay until the end because the final warning sign is one that many people mistake for normal aging, and that misunderstanding can delay life-saving treatment. Before we begin, remember that this video is for education only. If you or someone you know experiences sudden stroke symptoms, call your local emergency services immediately. A stroke is a medical emergency, and fast treatment can greatly improve the chances of recovery. Let's begin with the first warning sign. The first silent warning sign is sudden numbness or weakness on one side of the body. This is one of the most common early signs of a stroke, yet many people dismiss it because it can come and go quickly. Imagine you're sitting at the breakfast table enjoying your morning coffee. As you reach for your mug, your hand suddenly feels strange. Maybe it feels heavy. Maybe your fingers seem clumsy. You shake your hand, thinking it simply fell asleep. A few minutes later, everything seems normal again. It's easy to forget about it. But that brief episode could be your brain sending an important message. Your brain controls movement by sending electrical signals through nerves to different parts of your body. During a stroke, or sometimes before one, blood flow to part of the brain can be interrupted. Without enough oxygen and nutrients, that area of the brain can't communicate normally. The result may be weakness or numbness, often affecting only one side of the face, arm, or leg. Some people describe it as their arm feeling unusually heavy. Others notice they can't grip objects as firmly as usual. Some feel tingling, almost like tiny pins and needles, but only on one side. The key word here is sudden. Gradual weakness that develops over months is more likely related to another condition, but weakness that appears suddenly deserves immediate attention. A simple way to remember this is to compare both sides of your body. Can you smile evenly? Can you lift both arms without one drifting downward? Does one leg suddenly feel difficult to move? If the answer is yes to any of these changes, especially if they happen suddenly, don't wait to see if they improve. Even if the symptoms disappear after a few minutes, they may represent what doctors call a transient ischemic attack, often shortened to TIA. Some people call it a mini-stroke. Although the symptoms may go away, a TIA is a serious warning that a larger stroke could follow, especially within the next few days. That's why medical evaluation should never be delayed. And while weakness is a warning many people recognize, the next sign is even easier to overlook because it often lasts only a few seconds. The second silent warning sign is sudden trouble speaking or understanding words. Have you ever walked into a room and forgotten why you were there? Most of us have, and that's usually a normal part of everyday life. But imagine you're talking with your spouse, a friend, or your grandchild. Suddenly, the words coming out of your mouth don't sound right. Maybe you know exactly what you want to say, but the words simply won't come. Or perhaps someone is speaking clearly, yet their sentences suddenly stop making sense. That is very different from ordinary forgetfulness. Language is controlled by specific areas of the brain. If blood flow to those areas is interrupted, even briefly, speaking or understanding speech can become surprisingly difficult. Some people begin slurring their words as though they've had too much to drink, even when they haven't had any alcohol. Others use the wrong words without realizing it. Family members are often the first to notice that something sounds unusual. For example, someone might ask, "Would you like some tea?" And instead of answering normally, the person responds with words that don't fit the conversation or struggles to complete even a simple sentence. These episodes may last only a few minutes before normal speech returns. Because because the symptoms disappear, many people decide not to tell anyone. That can be a dangerous mistake. Research has shown that temporary stroke-like symptoms deserve urgent medical evaluation because they can signal an increased risk of a future stroke. Even if everything feels normal afterward, the underlying cause still needs to be identified. If you ever notice sudden slurred speech, difficulty finding common words, or trouble understanding simple conversations, don't assume it's stress, fatigue, or just getting older. Seek medical attention right away. You may have heard of the FAST test for stroke. F stands for face drooping. A stands for arm weakness. S stands for speech difficulty. And T stands for time to call emergency services. It's a simple reminder because acting quickly gives healthcare teams more opportunities to use treatments that may reduce long-term brain damage for certain types of stroke. Those treatments are most effective when people get help as soon as possible after symptoms begin. So far, we've talked about weakness and speech problems, two warning signs many people have at least heard about. But the next warning sign often catches people completely by surprise because it can feel like nothing more than an ordinary dizzy spell. Understanding the difference may help you recognize when dizziness is simply temporary and when it deserves immediate medical attention. The third silent warning sign is sudden dizziness, loss of balance, or difficulty walking. Almost everyone has experienced dizziness at some point. Maybe you stood up too quickly, skipped lunch, or became dehydrated on a hot day. In many cases, dizziness has a harmless explanation. But when dizziness comes on suddenly, especially along with trouble walking or keeping your balance, it can sometimes be a warning sign that part of the brain isn't getting enough blood. Think about the last time you walked across your living room without giving it a second thought. Your brain was quietly coordinating dozens of tiny movements, your eyes judging distance, your inner ears helping with balance, and your muscles responding almost instantly. It's a remarkable system that usually works without us even noticing. When a stroke affects the parts of the brain responsible for balance and coordination, that smooth system can suddenly break down. You may feel as though the room is spinning. You may stagger as if you've had too much to drink. You might suddenly need to grab a wall or a piece of furniture just to stay upright. Some people describe feeling as if they're being pulled to one side. Others notice that their feet simply won't go where they want them to go. These symptoms can easily be mistaken for an inner ear problem, which is much more common and often not serious. The challenge is that it can be difficult to tell the difference without a medical evaluation, especially if dizziness is accompanied by other stroke warning signs. That's why context matters. If dizziness appears suddenly and is severe, especially if it's paired with weakness, numbness, trouble speaking, double vision, or a severe headache, don't wait to see if it passes. Seek emergency medical care immediately. Falls are another concern. As we get older, a sudden loss of balance doesn't just increase the risk of stroke complications, it also raises the chance of serious injuries like hip fractures or head trauma. Even if a fall seems minor, it's worth discussing with a healthcare professional if it happened after a sudden episode of dizziness or loss of coordination. Here is a practical habit that may help. If you ever experience an unexpected spell of severe dizziness, resist the urge to drive yourself to the hospital. Sit or lie down in a safe place, let someone nearby know what's happening, and call emergency services if stroke symptoms are suspected. Remember, it's always better to have a symptom evaluated and discover it wasn't a stroke than to ignore a true warning sign. Now, the next warning sign involves something we all rely on every waking moment, our eyesight. And because vision naturally changes with age, this symptom is often dismissed far too quickly. The fourth silent warning sign is sudden vision changes. Many older adults expect their vision to change over time. Reading glasses become stronger. Night driving becomes more difficult. Bright lights seem more uncomfortable. Those changes usually happen gradually. Stroke-related vision problems are different. They often appear suddenly. Imagine you're reading the morning newspaper and, without warning, part of the page seems to disappear. Or you're watching television and notice that one side of the screen suddenly looks missing. Perhaps one eye suddenly becomes blurry, or your vision doubles for no obvious reason. These are not normal signs of aging. Your eyes collect visual information, but it's your brain that makes sense of what you see. If blood flow to the visual processing areas of the brain is interrupted, vision can change almost instantly. Some people temporarily lose sight in one eye. Others develop double vision, making it difficult to judge distances. Some notice dark spots or missing areas in their field of vision, almost like someone has erased part of the picture. Because these changes aren't usually painful, people sometimes decide to wait until the next day before mentioning them. That delay can be risky. Sudden vision loss or unexplained visual changes should always be taken seriously, particularly when they occur alongside other possible stroke symptoms. Of course, not every vision problem means a stroke. A condition such as retinal problems, migraines with visual symptoms, or other medical issues can also affect eyesight. But the important point is this: sudden vision changes deserve prompt medical attention so the cause can be identified quickly. Here's a simple question to ask yourself. Did this vision change happen all at once? If the answer is yes, don't simply assume it's because you're getting older. Contact emergency services or seek immediate medical evaluation, especially if another stroke warning sign is present. We've now covered weakness, speech changes, dizziness, and vision problems. Each of these symptoms may seem unrelated, but they all have one thing in common: they can appear suddenly because the brain is temporarily or permanently losing its normal blood supply. The next warning sign is one that surprises many people because it doesn't affect the arms, legs, or eyesight first. Instead, it often begins with the face itself. Many people notice it only when they look in a mirror or when a loved one points it out. And recognizing it quickly can make all the difference. The fifth silent warning sign is sudden facial drooping or an uneven smile. This may seem like an obvious symptom, but in real life, it often isn't. Many people don't spend much time looking closely at their own face during the day. If a small change happens, they may never notice it. In fact, it's often a spouse, friend, or family member who spots the difference first. Imagine you're enjoying lunch with your daughter. She suddenly pauses and says, "Dad, are you okay?" One side of your face looks different. You smile and feel perfectly fine. But when you glance in a mirror, one corner of your mouth doesn't lift the same way it usually does. Maybe one eyelid seems to droop, or one side of your face feels strangely numb. These changes can happen because the muscles of the face are controlled by the brain. If blood flow to the area controlling those muscles is interrupted, the signals become weak or stop altogether. Sometimes the change is dramatic. Other times it's so subtle that only someone who knows you well notices it. That's one reason strokes can be missed in the early stages. People often expect every stroke to look severe. In reality, symptoms can begin quietly before becoming much more serious. A helpful way to remember this warning sign is through the face part of the FAST test. Ask the person to smile. Does one side of the mouth droop? Does the smile look uneven? Does one side of the face seem less responsive? If the answer is yes, don't wait to see if it improves. Call emergency services immediately. It's also worth mentioning that facial drooping can have causes other than stroke. One example is Bell's palsy, a condition that affects the facial nerve and can also cause one side of the face to become weak. While Bell's palsy is different from a stroke, it can be difficult to tell the difference without a medical evaluation. That's exactly why sudden facial weakness should always be treated as an emergency until a healthcare professional determines the cause. Now let's move to a warning sign that many people underestimate because they assume it's just a headache. The sixth silent warning sign is a sudden, severe headache that's unlike your usual headaches. Not everyone who has a stroke develops a headache. In fact, many strokes occur without any pain at all. But when a sudden, extremely severe headache appears, especially if it's the worst headache you've ever experienced, it should never be ignored. Some people describe it as feeling as though a switch flipped inside their head. The pain reaches maximum intensity within seconds or minutes. It doesn't feel like the tension headache you've had after a stressful day. It doesn't resemble the mild headache that improves after drinking water or getting some rest. It's something entirely different. This type of headache can sometimes occur with bleeding in or around the brain, a condition that requires immediate emergency treatment. Other symptoms may appear at the same time. You might feel nauseated. You may begin vomiting. Your vision may become blurry. You could become confused or unusually sleepy. Bright lights might suddenly feel unbearable. The important point isn't to diagnose the cause yourself. It's to recognize that a sudden, severe headache that's completely out of the ordinary deserves immediate medical attention. Of course, headaches are common and most are not caused by strokes. Migraines, infections, dehydration, and many other conditions can also cause significant pain. But the timing and intensity matter. If a headache appears suddenly and is unlike anything you've experienced before, especially if it's accompanied by weakness, numbness, trouble speaking, vision changes, or difficulty walking, don't wait to see if it fades. Call emergency services right away. Early treatment saves brain tissue. Every minute that blood flow is interrupted, millions of brain cells can be damaged. That's why healthcare professionals often repeat the phrase, "Time is brain." The sooner treatment begins, the greater the chance of reducing long-term disability for eligible patients. We've now discussed 6 warning signs that can appear before or during a stroke. But the final warning sign may be the easiest to dismiss because many older adults chalk it up to normal aging, poor sleep, or simply having a busy day. In reality, it can sometimes signal that the brain isn't functioning normally, and recognizing it early could prompt someone to seek help before more serious symptoms develop. The 7th silent warning sign is sudden confusion or a noticeable change in thinking. Everyone has moments when they forget a name or misplace their reading glasses. That's a normal part of life. What isn't normal is a sudden change in the way someone thinks, understands, or responds. Perhaps a normally sharp neighbor suddenly seems confused about where they are. A family member struggles to follow a simple conversation they've had many times before. Someone who usually manages everyday tasks with ease suddenly can't figure out how to make a cup of coffee or use the television remote. These changes may seem subtle at first, but when they happen suddenly, they should never be dismissed as just getting older. Confusion during a stroke happens because parts of the brain responsible for thinking, language, or awareness are no longer receiving the oxygen-rich blood they need to function properly. Family members are often the first to notice these changes because the person experiencing them may not realize anything is wrong. If someone suddenly becomes confused, unusually disoriented, or has difficulty understanding simple instructions, especially if other warning signs are present, treat it as a medical emergency. As we've seen throughout this video, stroke warning signs don't always arrive all at once. Sometimes there is only one subtle symptom. Sometimes the symptoms disappear within minutes. But even temporary symptoms can be an important warning that should never be ignored. Let's quickly bring everything together. Watch for sudden weakness or numbness on one side of the body. Pay attention to slurred speech or difficulty understanding words. Don't dismiss sudden dizziness or loss of balance. Take sudden vision changes seriously. Notice if one side of the face begins to droop. Never ignore a sudden, unusually severe headache. And be alert to sudden confusion or unexpected changes in thinking. The easiest way to remember the most common stroke warning signs is the FAST test: face drooping, arm weakness, speech difficulty. Time to call emergency services. If you notice any of these symptoms in yourself or someone else, don't drive yourself to the hospital and don't wait to see if things improve. Call emergency services immediately. Fast medical care can make a significant difference in treatment options and recovery. The good news is that while not every stroke can be prevented, many risk factors can be reduced through healthy habits. Managing blood pressure, staying physically active, eating a balanced diet, not smoking, getting enough sleep, controlling diabetes if you have it, and working with your healthcare team to manage conditions like high cholesterol or irregular heart rhythms can all play an important role in supporting long-term brain health. Knowledge is one of the most powerful tools we have. Simply recognizing these warning signs could help you respond more quickly if an emergency ever occurs, for yourself or for someone you love. If you found this video helpful, we'd love to hear from you. How old are you, and what country are you watching from? Have you ever known someone who experienced a stroke or a mini-stroke? Your experience may encourage and educate someone else in our community. Thank you for spending this time with us. Stay informed, stay active, and most importantly, take good care of yourself and those you love. We'll see you in the next video.